We are as strong and determined as the French. Just like them, we will not give up until we have the health care we were promised. Whoops, I just lost it. The city has reneged on a contract it had with us when we were active workers. The bargain was sacrifice wages now, but when you retire and when you need it most, you will have publicly funded, premium-free, quality health care. Yesterday, with one stroke of his pen, and no doubt to preempt this rally, the mayor broke that contract with us and instead signed a contract with Aetna. A private, for-profit health insurance company under investigation for fraud and whose loyalty is not to its clients, but its shareholders. Their bottom line is more important than our lives.
There is an African proverb that says, working together, the ants ate the elephant. Let me say it again. Working together, the ants ate the elephant. Now, we are the ants. We symbolize right and justice. And the city bureaucracy, the healthcare companies, the insurance companies represent the elephant. They represent greed and power. But let me tell you this, colleagues, fellow retirees, we are in the fight of our lives. We will not give up. And let me be specific. The bureaucracy here in New York City tells us that moving us into a Medicare Advantage program will save the city $600 million. That is not true.
Not true.
$600 million represent 0.6% of the New York City budget, which is more than $105 billion.
As most of you know, the City of New York has been trying to change our health care from what we have now, which is Medicare with a premium free to us Medigap plan, and they have been trying to change it to a totally privatized Medicare Advantage plan. And yesterday, Mayor Adams signed a contract with Aetna CVS. We say no. Now, Mayor Adams tells us that this new plan will be as good or better than what we have now. Mayor Adams tells us this. However, Mayor Adams,
where is he?
Here he is.
Oh!
Mayor Adams.
Mayor Adams!
Mayor Adams, we are not fools. And also, health care, not profit care.
Health care, not profit care.
Okay. Not profit care. Health care, not profit care. Thank you.
But you've been fighting for every single New York City worker that's currently employed. Imagine working for New York City for decades, keeping this city stable. When people didn't want to come to work, you did. You came in and you made us feel proud of the city that we live in. And now what's happening is our mayor is turning his back on the people that sacrifice everything for every single New Yorker. And that's a shame. Our mayor is using a false narrative. We have to save money. But let's talk about the money. $600 million to care for 250,000 retirees, not including their spouses, not including their children. That's type of math that works in my book. And what's her city budget? $100 billion. He does not care about us. He cares more about the executives and shareholders of Aetna.
So listen, I'm gonna be honest. I've been making a lot of phone calls, trying to figure this thing out, and there's been a lot of complicated responses that I've gotten. But the one thing that I know is that the book shouldn't be balanced on the back of retirees who've already done the job that they were asked to do. And so it's hard for me to accept any answer that makes retirees have to make decisions that no one should have to make, whether or not they can afford rent or afford to get their health care. And people who have been getting life-saving drugs for a very long time will now be charged money they were never charged before. And so what I'm calling us, everybody who's at this table, including the mayor, you gotta come back to the table, because this is a very bad precedent that we're setting to tell retirees who have grown accustomed to agreements when they first got out of work that they can be changed at any moment in time. That's not the message we want to send to retirees or to active people who are working right now, who are expecting to get the care that they deserve, that care can be snatched from them.
They tell me, am I going to be able to afford to see the doctor that I've been seeing for decades? Am I going to be able to afford this prescription that is keeping me alive and active? Am I going to have to choose between healthcare, prescriptions, rent, or food? And you know what? It's annoying. I'm frankly so very annoyed that you have to be fighting as hard as you are right now to get something that you have already been promised. When you took this job, the job that you worked so long ago, the health care was one of the perks, because we all know city workers are underpaid, right? And so the health care was supposed to make it worth it. And now, 30, 40, 50 years after you said, yes, I will spend my life serving the city, the rug is being pulled out of you. And quite frankly, that's not fair.
Workers, they are the low-income retirees I'm talking about, the clerical workers. I have a member of the board of my association, Sally. Sally, between her pension and her Social Security, gets less than $15,000 a year. How can she live in the city of New York? That's right, it's a shame. And there's another word that I would use before shame, but I'm trying to keep my act clean. It's more than a shame. How can she pay for health care, rent, and food? Well, she has to double up with her kids. She can't afford her own apartment. She has to live with her kids. That's the reality that people face.
I'm here to shout out and call out to my other fellow active workers to say it is time for us to organize alongside of our union siblings, the retirees, because to protect them, but to also protect our own health care. If you think that the city is going to try to amend the code to save money but will not come to us next, that seems foolish. But ultimately, it's going to be about a real cure. We need to regulate hospital pricing. We need to bargain on drugs. We need to stop pretending that privatizing care and cutting benefits is the solution.
Medicare Americans got to go. Hey, hey, ho, ho. Medicare Advantage has got to go just for profit. Mayor Adams, you must stop it. Medicare Advantage is just for profit. Adams, you must stop it. Medicare Advantage is just for profit. Mayor Adams, you must stop it. Medicare Advantage is just for profit. Shut it down. Shut it down. If we don't get it, shut it down. New York City's rising healthcare costs must be addressed, but reversing a decades-long commitment to city retirees is not the right path. Forcing municipal retirees out of their traditional Medicare supplemental senior care plan not only breaks a solemn commitment to retirees who accepted lower wages in exchange for the promise of good benefits and excellent health care. So come on down and get your mail. We just read it to you. Hold on.
Okay.
Thank you. All right.
Okay, please.
Took it.
I'm with the Cross Union Retirees Organizing Committee. We've been out here for 2 years since we found out that the city was sitting behind closed doors, wheeling and dealing to diminish our health care. And I'm one of hundreds of thousands of retirees who have resisted this all along the way. We've had litigation successfully. We went to the city hall and lobbied and made sure that they did not change the law. And Croc has been on the street. That's what we do. This is our April Fool's rally, and our message to Mayor Adams is don't treat us like a bunch of fools. We weren't born yesterday. Croc is made up of many different unions. We are in our 60s, 70s, 80s, and 90s. We know what's going on. We can tell when they're lying to us. And the fact that they signed this contract before April 1st, when there was an option C available for them to sign that so that we would be able to keep the supplemental insurance that we now have. Now, they kept telling us for months that Aetna would not allow that. Well, when we saw the contract, we did see that there was an option for that. The mayor decided to go ahead and sign it anyway. And we are angry, and we are out here. And I can speak for Croc. I can probably speak for the thousands of retirees who couldn't come here because maybe they're homebound. Maybe they live in Florida. Maybe they live in Utah. What are they going to do with this new privatized, corporate-run, for-profit Medicare disadvantage plan? We will oppose this for the long term. Yeah, from what we understand, the mayor and the city decided to go with the nuclear option, what we call the nuclear option. They are going to throw and force everyone into a Medicare Advantage plan. We used to have choice. We had 12 choices of Medicare, of medical insurance that we could choose from. So now they want to throw us all into that one. If we don't want that, then we will lose all of the other health benefits that we now have and that we've always had. Reimbursement for our Medicare B. We will no longer receive our Medigap supplemental plan that we have always had called Senior Care. We will no longer have any insurance available for our dependents. I, for one, have a son who I have insurance for him. We will lose that, and we will lose our drug plan. In essence, we're going to lose everything.
Now you've been paying into Medicare basically your
our whole lives.
Right.
We've been paying. Now we will keep, if we opt out of this Medicare disadvantage plan, then we keep our traditional Medicare. Everybody has traditional Medicare. What we will not have is our supplemental plan, which pays for the 20% that Medicare does not cover. And we will not be able to cover our dependents, and we will not have what they call Medicare D plan, which covers our drugs. And I am a retired UFT. My union, Michael Mulgrew, is the head honcho who got this passed. And he has never listened to the rank and file. And we will do everything in our power to vote him out. Mayor Adams is a one-term mayor. He will be voted out. We don't remember. We weren't born yesterday. We're lifelong unionists and activists. And we will make sure that the right people get in during the election and that the wrong people are voted out.
Go tell it to the nation on Capitol Hill and everywhere. Go tell it to the nation. We all deserve health care. It's time to work for changes. It's time to face the facts. When children